Good day, everybody. Thank you for being here today with us. Again, that's Dr. Francois from Sri Lanka, but in my heart from Canada. And I'm telling that today because I have a Canadian guest today. I'm very happy. Miss Canada so much. Today, we have Josh Crawford. Josh is having a very special modality. We are not talking so much often about that modality. It is called photobiomodulation. And he's going to talk about that. So he's working with light and he's working for a long time in the healthcare system. Before Josh was, I would say, a paramedic, right? He was working in paramedic in Canada, and he decided, because for a number of years he was working with neuro rehabilitation with patients and that were having trauma, and he's going to talk to us about that. And along his path, he chose to work with light. Amazing, huh? So light is working. Light is photons, and light is having a lot of properties. So Josh, first of all, thank you for being with us today. Thank you very much and welcome.
Thank you. Thank you, sir.
Thank
It was,
you.
it was an interesting message to get from Sri Lanka, I must say.
Yes, yes. Right. So Josh, so your path came, you started to study in biology. That was your first field of interest, and then you jumped into nutrition, and you became a paramedic, and you founded a company that is called Genoa Integrative Health and Wellness, right, in BC, British Columbia, right? So can you talk about your path and how did you come to light therapy? How did you discover that?
Well, totally by accident, like these other stories that I hear about people finding their paths and their journeys. My original dream was to be a veterinarian, so hence the original degree in biology, which that got me a job planting trees. So as far as the idea of education, veterinarians apparently are a lot smarter than I was. So yes, you had to get a lot higher grades to get into veterinary school. But my passion, I grew up in a paramedic, and my dad was a paramedic, and my mom was an emergency room nurse. So our dinner time conversations were pretty unique and inspiring. So I became a firefighter at a very young age, a junior firefighter at 14. I worked my way into the fire departments doing first responders and training. I was one of the youngest instructors, because literally I would go into these first aid room settings as a kid and I'd be a patient. Well, I learned via osmosis. So when I challenged the first aid course the first time at 17, they told me that I was too young because I wasn't an adult here in Canada. So I started very early. I loved the firefighting and emergency services, became a paramedic, worked my way through, became as highly qualified as I could go in through the BC paramedics. So my love for that kind of medicine and help is just part of who I am. When started getting into all of this other holistic stuff, so remember, science trained, all of this Ayurvedic and meditation and all of this type of thing in my eyes and my training was all wing of bat, eye of newt, voodoo stuff as far as I was concerned, because I didn't understand it.
How did you jump in that then? How did
Well, I got
found a
married.
voodoo?
Yeah,
Did
exactly.
you
Well, I got
find a
married.
voodoo teacher?
Yeah, I got married early to at 23. I got married, and my wife had Crohn's disease.
Oh.
So she again wasn't getting any help with the orthodox medicine and things like that. So that sort of opened the door for me being learning being taught about all of these nutrition and diets and acupuncture and meditation and yoga and Ayurvedic medicine and naturopath and stuff like that. So I started studying. Again, I just can't stop learning. I need to know why. I need to know what's going on. I need to have that science answer with evidence and base. So long story short, 20 years later, after a long, long journey in a battle, we lost her to cancer after orthodox treatments. And I won't say the medication names and stuff like that she was on, so I don't get myself in trouble. But my journey, I always thought that I was a part of her journey. It was funny
Yes.
how you ask how the journey was. I thought I was on her journey. And then it turns out that all of these paths and all of these lessons was all about me and about learning that my passions and my skills of all of these other modalities would eventually lead me to this concept that I wanted to build an integrative health center. And this is before I even knew about laser. So I developed a concept, just like everyone else that's opening up these integrative centers.
Right.
That's just like, it's not just one modality. There's no magic bullet. It's this synergistic effect of multiple modalities. Right. Acupuncture, nutrition, diet, all of these things all come together in what we're looking for in what we call wellness.
Integrating all of them together.
Exactly. And so I had physiotherapist, naturopath, acupuncturist, a functional medicine doctor that I literally pulled together and said, hey, do you guys want to come together and build an integrative health center? And they, wow, yes, we all want to work together. So I signed a lease on a new building that was being built. And I put the money up to be the clinic coordinator. So still no practitioner. I wanted to build this, be the brainchild, and watch it flourish. Well, the developer fell apart. The building didn't work, so I got my deposit back, and now I'm buildingless. So all of these practitioners that we had together re-signed their leases in their buildings, and everybody kind of went their own way and said, hey, we'll revisit this in 2 or 3 years after our leases come due. Well, then I got a phone call from a dear friend, Dr. Bill Code, who's a functional medicine doctor. And he says, why don't you check out this light therapy stuff? And I said, oh, okay. So I inquired, I signed up for this conference. Then I got a phone call from the rep from Thor Photomedicine. And his first question to me was, okay, what's this integrative health center? And where the hell is Duncan, BC?
Two very good questions.
Yeah. And I said, well, we're on Vancouver Island, which is, an 800-kilometer long island that's bigger, almost as big as Britain. And he says, what are your clients? And I said, well, how does prenatal to geriatric sound? That's our client base that we're looking at. And he says, well, you have to come and meet James Carroll, who's the owner and founder of Thor Photomedicine. And so I hop on a plane, I fly to San Francisco, I meet this crazy Englishman. I'm coming down there. I have zero background. I didn't start researching light therapy until I literally got on the plane and had Wi-Fi at the airport to start looking at these modalities. And it literally blew me away. And then I met James, and so how he actually explained PBM to me, and it wasn't just from Thor Photomedicine standpoint, it was sharing the research, sharing the thousands of studies.
Yes, there is a lot of studies in photobiology.
Oh my gosh. I mean, at that time, that's now almost 6 years ago, there was over 3,000 studies.
Right.
And at 3,000 studies, I mean, now that's getting some attention, but that's over 40 years. So jump ahead till now, I think there's something like 6,000 studies. It's almost doubled in the last 5 years.
Yeah.
So the evidence and the momentum is building, and it's all peer-reviewed, double-blinded, placebo-controlled,
Yeah.
medical studies that are being
Yeah.
done. So it's
So
not just
it means basically that it works.
exactly.
If we are making it short, it does work.
Yeah.
Right?
And now I have the benefit of now having over 5 years clinical experience in our little small town. And just to give you a perspective, the city of Duncan is rated at 5,000 people population. The city of Duncan is 1 square mile, but then we've got this outlying rural area, so it's quite a big area. But I've been getting phone calls because our quote on our information sheet is that we have over 3,000 active clients. So
Wow.
3,000 active clients in a Duncan population that only has
It's
5,000
everybody.
people. Exactly.
It's everybody. Very good business.
Yeah. So, but we also have, I believe, and I haven't been told otherwise, we have more equipment in our little clinic. It's now, okay, little. It started out as one device in my living room. Okay. So
Yeah.
just to give it perspective, one device, a nearly $30,000 Canadian piece of equipment, started out in my living room to now we have had 2 different offices that we've doubled our size. So we're now a little over a 6,000 square foot facility with 12 rooms, a teaching, I think it's 1,000 square feet upstairs that we've got for a school,
teach.
like
You
where we
teach
teach
that.
stuff at the lecture hall. And we've got nearly, I'm going to go on a limb and say almost $2 million worth of photomedicine equipment.
Wow.
We have 4 whole body beds. We have 10 handheld desktop devices that we use in our rooms. We've got a whole bunch of portable equipment that we're trying and testing. We're trying to get home use devices so people can have gentler treatments between their clinic sessions at home. So we treat anywhere between 30 to 40 people a day.
Wow.
So we have a ton of experience. I think we did the numbers that we did at year end. We're nearly 30,000 treatments that we've done.
It's amazing.
That we've been open. So
right. So right now, Josh, I would like to jump into the theory because I'm keen to understand. I'll fake that I don't know nothing about photobiomodulation, which is not true.
All right.
Let's pretend I don't understand. I don't know what it is. So
don't worry,
someone that has no idea, what is it? What is photobiomodulation? Explain me this.
Well, you're 99% of our clients. So we don't try to come in when people ask us what it is. We don't try to sound like doctors because we're not. We're technicians. We are photobiomodulation specialists, and we're experts at applying light. That's what we are. So if you're a mechanic coming in, I'm going to try to explain it to you like a mechanic. Or if you're a science buff, then we're going to get into more science terms. But at the end of the day, light is absorbed into the body. We use different wavelengths of light. Wavelengths are color. Different colors go different depths into the body. Different cells absorb different wavelengths at different times. So we have this cornucopia of options when we're treating somebody. So photobiomodulation, it really does one thing and one thing really well. Is it fights inflammation, it treats you at the cellular level and energizes your body to do what it's supposed to do. It's that simple. So if you can get the right amount of photons into the right part of the human body, you can create change and balance and homeostasis. And homeostasis is our goal.
Yes, basically this is what holistic medicine is about. Homeostasis, stabilizing the body to maintain the balance. But the reason why it works is because cells are sensible to photon, isn't it? And it reacts to photon, and by projecting some specific wavelength, some specific photons to cells, we start a process. Is that correct?
Yeah, correct. The photochemistry is where that photon gets absorbed into the cell. The most popular and the most common research point is the cytochrome C oxidase receptor in the mitochondria. So that's the power plant in the cell. But we also know that chromophores, or where cells that actually absorb photons, we know hemoglobin is a photoreceptor, and we know water is a photoreceptor. So different wavelengths are absorbed into those three specifically at different ways. So higher wavelengths, so getting up into more infrared and higher above the 850, 900, 1,000 wavelengths, where like infrared saunas and stuff like that get into, there is no photochemistry that happens there. It just excites the water. So the water absorbs it and you get warmth and heat, okay? But when you're down lower into the near infrared and into the blues, the greens, things like that, blues and greens are more into the hemoglobin.
Yeah.
So you've got higher absorption in the hemoglobin. But the sweet spot to get real cellular regeneration is in that red infrared range, which is all cytochrome C oxidase. And that's where you get the magic. All the other sort of
what magic? Explain me that magic.
Well, the difference between being sick and not sick.
Oh, I'm very happy to hear that.
Right? That's the difference.
Yes.
The difference between having brain fog and being able to have a conversation without falling asleep halfway through. The difference between having osteoporosis and healthy bones. Right. The difference between an athlete being able to run a 12-second 100-meter or a 9-second 100-meter. It all depends on the health and vitality of the specific group of cells that are either damaged, impaired, or what we call oxidized. So oxidization is literally just the breakdown or stress of cells.
Yeah.
And oxidative stress can come from trauma. It can come from actual injury, strain. It can come from infection, biological, chemical.
It doesn't matter.
It doesn't matter. Emotional stress, these concept that someone sees somebody getting beaten up or somebody watches somebody get hit by a bus, they actually have the same chemical physiological changes as the person that actually got hit by the bus.
Right, that is correct.
That's the kind of stuff that a lot of people don't understand. And even me as a paramedic.
Yes, I was about to say, before you didn't leave, you thought you were a Voodoo.
Oh, the PTSD and things like that my colleagues and things that I've seen and witnessed, and even though they're rushing in and doing the support, the burden and that constant emotional stress on them has been devastating.
Yeah.
So to actually be able to treat someone's PTSD and help them get better and feel happier and more productive, and realize that, I think with PTSD, a lot of the psychology and stuff around it, people say that, oh, I haven't changed, the people around me have changed and how they deal with me, right? I mean, that's a big concept, that just like Alzheimer's, dementia, Parkinson's, the people that have the illness, they see everyone else changing, but they can't see how they're interacting with the people around them. And it's all oxidative stress.
Yes.
And if we can treat that condition, get their dopamine firing, get their microbiome firing, and get everything actually working in balance, people can actually regain joy and productivity and just relationships and things like that, which is isn't that all we're here for?
Yes, absolutely. Josh, I have a question that burns my lips. Is you were prepared before you jumped into I'd say, holistic medicine. You were prepared by your past, having been a fireman. You should have seen so many terrible things. So I have working with paramedic with brain injuries. You should have seen so many terrible things. So right now you are having a concrete solution that classic Western medicine don't have, right?
Yeah.
And we were talking about integrative medicine. So those two things works together, isn't it? So integrative medicine is not separating the two parts, yeah, integrating all of that. So talk to me about that, because you were working with these patients previously, no?
Well, and it was funny. As a paramedic, you work 4 days on and 4 days off. So in my 4 days on, my 14-hour night shifts and my 10-hour day shifts, going through the trauma, and then on my days off, I'd worked as a program coordinator at a brain injury rehab center, and I saw the actual clients that I'd picked up off of the street months before come through our program. And that was probably the most traumatic for me, because when I would leave an accident scene, I did my job, we got them to the hospital, we did everything that we needed to do to keep them alive, either resuscitating them or doing whatever we needed to do. And then when they come to me in real life, that they can't walk anymore, they can't talk, they're in a diaper, they don't know who they are, they don't know their family, and then watching them just stay the same for years and years and years and years, that was more traumatic to me than actually dealing with the accident and the chaos at the scene.
Yes, wow, yeah, I can understand.
So, but also one of the things that got me interested into brain injury and stuff in the first place was my own injuries. I played high level hockey, and I played junior rugby and high school rugby and stuff like that. And I had 8 major concussions. So I got knocked out at least 8 times.
Eight
Those were the
times?
8 times.
And you're
So,
talking to me like this today?
okay, well, this is where the story gets better, because 5 years ago, there's no way I would have been able to carry on a conversation and learn and adapt and be able to teach at the level that I stay at, in the energetic level, without light therapy. So depression, anxiety, everything that went along with these concussions. When my clients come to us now, and I can look them in the eye and say, I understand.
Yes.
I've been to those dark places. I've been to that idea of not having self-worth and all of those things, and made really bad choices. And I'm only 5'8". I'm just under 200 pounds. So when a 6'4" guy starts beaking off and I try to swing for him and get in a fight playing hockey, it wasn't the smartest thing to do, but that was just my tenacious spirit. But at the end of the day, once you have an injury, that inhibition gets worse. You start going out and just having drinks with your friends, and now you're getting in bar fights. And that's not my personality. That's not who I was. So it took some pretty good kicks in the butt for me to realize that something was wrong. And when you get to those places, you got 2 choices. You either dig yourself out of it, or you just keep digging your hole deeper and deeper.
Yes.
So,
yes.
And the help and support that we had from PTSD supports and phone calls, and you go and talk to our fire department counselor and stuff like that, that wasn't good enough for me.
No.
And so now that I went through extra courses, the UBC program that we were through had all kinds of training, and I think it was almost 8 years that I worked out there. It really opened my eyes, but there were still no treatments for brain injury. like we teach them how to walk and talk and take them to the gym and do cognitive work and cards and all of the basic, occupational therapy type stuff. But
Was
there was
taking
no,
too long.
exactly, and there was no treatments. I mean, the idea of one client even getting access to hyperbaric oxygen. I mean, this is now 25 years ago. So hyperbaric oxygen, that's crazy talk. Why would you get inside a
Yes, that's
oxygen?
another Thor. Do you have that at your clinic? You have
Yeah,
that?
well, we have access to it. Yes. Yeah,
Right.
we've got a
Oh my God.
offsite.
That's another lecture, right?
Yeah.
So
Yeah.
hyperbaric chamber are very special things,
Yeah.
but
But the same thing, you're still treating mitochondrial impairment. You're
yes,
just using pressurized oxygen to get in there.
yes,
So
yes, yes.
So all of these modalities that we were seeing that were on the fringe 25 years ago, I didn't have a clue of how to access it or anything like that. So we just suffered. We just suffered through it. You have a bad day, you have a bad day. You work through it, you build yourself up, you talk to your friends and you kind of go through it. Now just jump ahead from that 25 years ago to now only 5 years ago. Here I was starting with this one desktop device in my living room, researching transcranial PBM, Dr. Lou Lim and Violite, and all of these researchers that were coming out, and I started experimenting really on myself. And all of a sudden, I'm able to stay up and read a scientific journal that's 29 pages long and full of Latin that I'm looking up and researching. And it's literally melting my brain. So I'm treating my frontal lobe as I'm reading these journals, and all of a sudden I'm feeling alert. So what did I do? I added oxygen to that as well. So I put on a 10-liter flow of oxygen out of our oxygen concentrator, just a little simple mask, and treat my head at the same time.
It boosted.
Holy cow.
Boom.
Absolutely.
Yeah.
So
yeah. So
then doing the research on the studies of why this is working, so we integrated it into the clinic. And now people are wondering why, holy cow, how come you're having such amazing results by adding oxygen and light therapy at the same time?
absolutely.
To me,
There
it
is
was
there is two things that comes to my mind. The first one is most of the therapists I'm talking to, they are their first patient. And that's the case for yourself. You became a therapist.
Yeah.
Your first client was yourself, right?
Yeah.
I can relate to that myself, right? But there is something more scientific that came to my mind. I remember in the year 2000, hearing reports from doctors telling us, no, neurons can't regenerate. And they found out, I think in 2007, something like that, in mice, they could realize that indeed it does regenerate. And I was at that moment treated by acupuncturist telling me, well, we know that since 3,000 years in acupuncture, that cells, brain cells can regenerate. But now science has evolved a lot, right?
Well, that's the thing. 25 years ago, when we were dealing with our brain injured clients, we were told that their neurons were dead. So we only are going to work with what's left. And I'll give you an example. You talk about one of the first clients that I ever worked on. He's actually a dear friend of mine. We went to high school together, and he cracked up his car at 17 years of age. Massive brain injury. He was an excellent hockey player. He was like this big, tough, strong kid. And was it April or May, he disappears after this car accident, and he comes back to school in September. And he's this skinny little kid that, as a young kid, you're like, oh my God, who's this? I hate to use the word, but we used back then when we didn't know better, we used, oh, who's this gimpy kid? He's all gimped up. And so jump ahead now, 31 years later, our kids go to the same school together. He's had he did well, he did rehab, he got strong, but he kept getting worse and worse and worse and worse and worse. So we're in the parking lot at the school. I think I had the laser for about 5 days. And I told him, I said, you have to come to my house. If you're not going to get in your car and follow me, I'm going to throw you in my trunk and bring you to my house and show you this. And we've been like really, really good friends. And Kurt, and he says to me, he says, well, I got nothing else to lose. He just had like whooping cough and he collapsed and he had raccoon eyes because he smacked his head again because he fell and he could hardly stand. He was all wobbly. So we come to the house and in 3 treatments,
very fast.
He was able to go from 5 minutes to being able to stand up and watch his kids play hockey. Within 3 minutes or 3 sessions, he went to watching 2 games back to back, standing and cheering at the glass.
Wow.
And if you're a dad that loves hockey and you're Canadian, he came to me after that weekend, after he stood, and he was so excited. But the one thing that I noticed in him was he was able to talk to me and explain it to me all in 2 sentences, continuous, no breaks. Voice was stronger. All of the cognitive stuff that we measure during rehab, that was after 3 sessions, after 30 years of injury.
Well, Josh, you became a voodoo.
Exactly. Yeah. Right.
So now I can't wait to see your gear because you said that you're going to show us your gear. So I'm excited to see that. Show us what you have, right?
Okay, well, here, we'll start with these ones. These are our basic tools. So these are the Thor Photomedicine basic devices. So LED lights and laser. Okay. Thor uses LED in their large clusters. They have a whole bed made out of these.
Yeah.
The lights in these ones. Here, I'll turn it on so you can see it. It's going to be really bright. So, so see how bright that is.
This is
the LED. LED. Yeah. So people can look right into the screen here, and we can treat your eyes internationally. How's that? You can treat
the eyes, right?
Macular degeneration.
Oh, really?
The LED can treat the eyes directly.
Without problem.
No problem at all. We've got multiple clients that have had multiple follow-ups with a decrease in their macular degeneration. People that couldn't see can see. Just amazing.
How many treatment do you need?
Some take a month, some take up to 6 months, typically depending on how bad the oxidative stress is or the damage determines how long the treatments are.
Because classic medicine can't do anything about that.
No. Again, it's mitochondrial damage. But
yes.
The beautiful thing about light therapy, when you're talking about, like, just as an example with macula, it's not just the blood supply to the macula, it's also the drainage, because you can get wet and dry macular degeneration. So there is no treatment for dry, but there is a needle that you can get. I think it's steroids and stuff, and you put it right in your eyeball and they squirt it into the back of your eye and it dries up the fluid. Doesn't fix the macula, but it's a treatment for wet macular degeneration.
Right.
This treats both.
This is near infrared and red.
Yeah. This uses 660, so red wavelength.
Right.
And it uses 850 near infrared.
Near infrared and red directly in the eyes.
Yeah, exactly. Wow. And we use a pulse too. So but it doesn't go very deep. So LED we use for treating superficial wounds. We treat lymphatics, so we can treat neck, subclavian, axilla, so armpits, behind the knee, groin, pretty much everything that's shallow for lymphatics or tissue, we're going to use LED for.
Muscles.
Right? Yeah, muscle recovery, depending on what muscles, it's a gauge, like anything anything over a couple of centimeters deep, that we're going to want to go to the laser. So think of it like the difference between concrete road and asphalt. If you're going to shine light and you be out in the sunshine, and you're standing on a sunny day and you stand on asphalt and concrete is right beside it, that asphalt absorbs way more energy, right? So darker tissue, muscles, and deep red, blood-rich tissue absorbs the light better. So, and as you're treating it with light, as it's going in, those photons are absorbing, so the light doesn't penetrate very deep, right? It takes up as much of the photonic energy as you can, where tendons and ligaments and things like that are almost translucent. So bone, the skull, perfect example, you don't need a whole lot of energy to pass through the skull. Right. It's absolutely almost clear. There's hardly any containment of the photons. So we use our LED lights a lot on the head. That's how we first started. Then we have a Thor helmet that literally has 15 of these lights inside the helmet at the same time. So
the people are wearing the helmet on their head.
Yeah. So the Thor helmet is around $40,000 US. It's a clinical grade. It plugs into the same base unit as all of these other heads. So it's kind of like a Swiss Army knife. You got acupuncture points or pointers that we can put in. We've got oral points that we can use for oral mucositis. There's even a great big giant laser cluster that you can get now, which is again 3B laser, 810 wavelength. So that's again near infrared. You can still kind of see it. So yeah. Here's the near infrared.
Right.
Okay. So you can see that I'm shining it right at the light, but you can see it's not as bright as the LED, but it's the same amount of power. This one's 1 watt, and I think this one's 1.3. This is 1.3 watts. So give you a difference. So there's the LED, pretty bright.
Right.
And then there's the 810.
Right. So basically, if I summarize, the laser go deeper.
The laser goes deeper. Yes, that's exactly it. So, but you also want contact. We don't just shine the light over the surface. We want to get
physical
right
contact.
Yeah, and if you can, it doesn't take a rocket science to see the difference. If I'm holding it there, you can hardly see any light. If I hold it there, what are we getting? You can see it on my face. It disappears. It bounces off. Right. And that's one of my big pet peeves in the PBM world, is that we have these marketing manufacturers that you stand in front of these really high, powerful panels and things like that, and they're claiming that we're getting photonic absorption. But
disperse.
Exactly. And I say to them, well, are you measuring the photons on the ceiling, the floor, the walls, the neighbor's house, because it's coming out the windows? Yes. And all of these studies that were done, there's been no real evidence-based besides contact. And contact is key. And that's one of the things that we teach a lot to our practitioners. And again, I'm not biased with people that are going to go and buy different manufacturers. I'm going to try to educate them and say, look, if you're going to do a treatment, you want to do a treatment that's specific, that's repeatable. If you have to move your head, and because you're using a class 4 laser that's really being absorbed into the water and you can actually burn somebody, how do you know the accuracy of your treatment? Right? The machine can tell you how much output it's given you, but I'm sorry, as you go over different tissue is going to absorb things differently. Right. So I'm trying to just I'm trying to play nice in the sandbox because I'm Canadian, right? So we apologize for telling people that they're wrong all the time. But I don't want to discourage practitioners from, like, say, these chiropractors that have these really powerful class 4 lasers that treat from distance. And they set it up, they put it over the one spot for 10 minutes, and then they can go do that on 5 other clients. That's fine. That's the cookie cutter approach. Everybody gets the same treatment. Everybody's getting some pain relief, and you're happy and you got clients coming back. But you're not getting that true photobiomodulation, which is
sustainable results.
Exactly. So but I'll still help a chiropractor that's got a class 4 and says, hey, I'm not getting all the benefits out of it. What else can I do? So I'll encourage them to do lymphatic drainage and things like that. Because if you're going to stimulate, you have to get the debris out of there.
Yeah.
And when you're pulsing and using the LEDs and the 3B lasers, you can actually stimulate that cleanup of the lymphatic.
And as I know, I'm not a photobiomodulation specialist yet like you, but the Nogier frequencies are there to support that aspect, the drainage. So there are some pulsated light therapy. Can you talk about it a little bit?
Yeah, so some of the basic pulses that we use in our clinic. So, and yes, I know the acupuncture pulses and the different frequencies and stuff like that. Our devices aren't set at that high a frequency. We use, for example, lymphatics and tissue repair. We use 2.5 hertz, so 2.5 times a second. We find that is the most benefit. And I kind of explain it like you're opening and closing the iron doors in a cell. Okay, so some cells respire at different rates. So, for example, I'm trying to treat a red blood cell, per se. Let's just say that. So, red blood cells are beautiful because they absorb the photons. It's really great. But as you're treating this cell, you have to think about how fast it actually breathes, how it lives, how it eats and breathes. That's what our cells do. They breathe oxygen, and they take nutrients in, and then they expel the byproducts, right? That's just normal cellular function. But if you do a continuous beam on these cells, picture the cell like your eyes. When the light turns on, you automatically blink your eyes. So that closes the door. It's when the light is off is when the door opens.
Oh.
Okay, so think of it like that. So when the light turns on, you blink. When the light turns off, the cell opens. And when the cell opens, that's when the magic happens. The oxygen goes in, knocks off the nitric oxide, goes into cytochrome C. Nitric oxide now gets released from the cell. The nitric oxide is now the vasodilator and the signaler, and all that cascade of events happens. But it's when the door opens. So if you're purposefully trying to do pain management, a continuous beam has been shown. Dr. Roberta Chow in Australia, I think, did most of those studies originally. And you can treat dermatomes, nerve roots, not the wound site. You treat away, and you treat those nerves, and you purposefully overtreat them and give them an anesthetic effect. So, 30 seconds, a minute. We do some trigeminal stuff when people have got really bad pain. We'll do up to 3 minutes continuous on one spot, and we actually get numbing like you've been to the dentist. People have actually had their teeth removed by using the laser on 2, 3, 4 minutes, and then it comes back quickly, so you can retreat it again with no damage. So that's pretty profound. So, but that's on a continuous beam on a local spot that's actually shutting off that nerve. So you're purposefully turning down the ATP production in that nerve. So you get numbing, or what we call anesthetic.
Without the side effect.
No toxins.
Yes,
Exactly.
because myself, when I go to the dentist, I know very well when they're shooting me this, my heart starts to beat, and
Oh,
I become very over palpit. I have some palpitation,
yeah.
and actually, my dentist is a very aware of that, but they are
Mhm.
using this. They don't know yet this
Yeah.
method. It is not known. Photobiomodulation, Josh, is not
I know.
known.
I
And
know,
how
it's
many
crazy.
years does it? 50 years now, right?
You can see how I get a little nuts about this because I couldn't believe it. I thought, being an educated medical personnel, that I would have heard about it in 20 years of dealing with a chronically ill partner. And all of these specialists, we went everywhere. We spent hundreds of thousands of dollars on specialty programs outside, even in orthodox medicine, from different biologicals, autoimmune condition treatments, so much. We went everywhere. And the idea that this was here the whole time really, well, pissed me off.
For
You know,
years and years. There is also an aspect of photobiomodulation that is not very much well discussed, which is the infectious disease and immunity. So, can you
mhm,
talk about it? Because you can fight bacteria, you can fight viruses, as UV is doing. Ultraviolet light is
yeah,
actually cleaning, disinfecting and sterilizing, but photobiomodulation can enhance the immune system. Can you talk
yeah.
about that aspect?
So this is funny. We just had. I don't know if you were familiar or saw the posts and the NBC articles and stuff of the surgeon in the States that was doing the COVID treatments with the treating the chest and things like that, double-blinded placebo studies and stuff. Well, there's a investigative reporter here in Canada who I actually grew up with, did a whole article on them, and it was called Shaw Spotlight. And I just got a message from him that he's now being censored. So we have to be very careful here, that we don't say that photobiomodulation is treating COVID, because it's not government approved treatment yet.
Yeah.
So just like we don't treat cancer,
No,
but
we can't claim that we cure anyway, right?
exactly,
As
exactly.
therapists, and I mean, scientifically speaking, we can't cure, we can't claim anything. We can
No,
just observe the result.
exactly. And here's the crazy thing: nothing cures or fixes the human body. Only the human body can cure and fix itself. Okay. All we're doing is trying to put it in a position where it has the ability to do that. Okay. That's the bottom line. And so we can use blue light, we can use green light, again, the hemoglobin absorption, shallow treatment, but we know it has antibacterial, antiviral, antifungal properties. So if we can boost the body's immune system, strengthen it by just energizing the specific cells, we can mobilize more mesenchymal stem cells. We can treat the thymus
Yeah,
and
I was about to
oh,
say that that's the
yep,
thymus that you are treating.
yep.
Are you using laser or are you using LED for that?
We're using the laser because of depth. So we've always treated along the sternum. So pre-COVID, our typical protocol for anyone that was inflamed or injured, we'd treat their sternums and their tibias with the 3B laser. And that was proven to mobilize up to 400% more mesenchymal stem cells. So mobilize. So we're not producing more, but all we're doing is stimulating the body to release them. And
Right.
that's been proven multiple times now. Cardiac clients, they did radioactive isotopes into the shin bones, treated the shins, and then I think half an hour later did a scan, and it was 95% of those radioactive isotopes were around a heart after a heart attack. So pretty amazing findings from this. So we added the stem cell treatments into probably 90 to 95% of our clients. Doesn't matter if you're coming in with a sore knee or a shoulder injury or a back spasm or Lyme's disease or MS or Parkinson's. So
Can you have some protocols in photobiomodulation for cancer patient? Is there?
absolutely. Again, we're just supporting the systems. We have MASCA, I think it's called, the multi-association international body that approves modalities that are supportive therapies for mainstream chemo, radiation, all of that. People have the option of doing their chemo and radiation, or opting out and doing holistic homeopathic kind of treatments and things like that through homeopathic oncologists. But light therapy helps support all of those modalities.
Yeah.
It helps the oxidative stress. So the healthy cells that are getting bombarded by the chemo and radiation, people aren't dying from the cancer. They're dying from the side effects of these treatments because their body's not strong enough. It's been beaten down.
Right.
So it doesn't. So we've had pancreatic cancer patients, became so close to us. And we had, 2 years of extra time with a dear friend by coming in and treating him in the bed and helping the stem cells. And his quote, he's on our as a testimonial now. We lost him last February, but he came in and he says, everybody says that, to keep upbeat and strong, and that's how you're going to get through these treatments. And he says, and this is an ex Rowing Canada Canadian rugby player, great big man, just a wonderful, wonderful human being. And he says, how in the hell are we supposed to be upbeat and positive when I can't even lift my leg out of bed because I'm absolutely annihilated with these treatments?
Right.
And he would literally crawl into the clinic because he knew how much better he felt after having a bed and a treatment and lymphatics and stuff. And he would literally come into the clinic gray and leave with rosy cheeks and actually knowing he's going to go and do this all over again and take these treatments. So the respect and the humility that we've learned from these clients that have got such courage, but to know that they were coming to us because we were keeping them going. We were helping their body fight off the onslaught of these treatments. And we've witnessed it time and time and time again now. And it's remarkable.
Yes. The aspect that surprises me the most, which because I was not aware of, is the oxidative stress from emotional burden. And you can actually support to like have an emotional kind of an emotional support from photobiomodulation. Can you talk to me about that? Because we have a lot of patients suffering from all sorts of conditions, such as trauma, post-traumatic shock syndrome, and you really can help them with that. Can you talk to me about this aspect?
Well, it's multi-layered as well too. Not only are we treating, the dopamine connections between the dopamine produced in the brain and the 50% of the dopamine that's produced in the microbiome. So the proof now that we have is that light therapy actually helps the microbiome as well. It produces a nice, happy environment so these little critters can multiply and do their job and produce the serotonins and the dopamines and all of the byproducts and neurotransmitters that are required for us to even feel happy. So we said to some people the other day, and they're like, "Oh, I just feel so down." Well, they just finished their second round of antibiotics because they had surgery and a staph infection. And they're like, I just don't feel motivated. I don't feel to do anything. Well, we know their dopamine production is in the tank. So let's treat the gut. Let's get the microbiome, get the probiotics into them. And within a very short time, like it was 2-3 days.
So you're treating the guts at that moment?
Absolutely. Treating the gut directly, the entire GI tract if we need to. So especially with someone that's going through treatments, that oral mucositis, oral mucositis is literally from the mouth to the anus. You can have shedding. So you can have literally a canker sore from the tip of your tongue right to your anus when you're going through, these types of treatments. So we have to treat that directly. So we will spend an hour session literally treating all the way along, do the entire GI tract.
Are you using the laser for that? You're using laser?
Absolutely, yeah.
With laser.
Yeah, depth is the only way that you're going to get through mass is to get the depth with that with the laser.
Right.
And yeah.
Wow, that's just overwhelming, and it is amazing. Before we leave, as I said to you, I will contact you again and talk about that university project. If you can, you want to show us?
I got one more thing I want to show you. So we talked about the helmets and the buckets, and I know you had Suvi on there from Australia, and she contacted me, I think it was last year sometime, or it was pre-COVID, and because we treat a ton of Parkinson's patients, again with the Thor device and stuff. But this, I don't know if you can see it. That's actually, I don't know if you can see it. I think I'm on mirror, so I'm backwards, but we actually have a 810 wavelength. It's rated at 15 watts of total output, but we've actually measured it at a little over 12.2. We've actually measured each individual bulb, and we've got our rating. So we have been blown away with this. I've been searching for at least 2 years now, trying to put things a little more affordable into people's hands that need treatments every day.
Right.
And, our treatments in clinic they're $120 for an hour. And that's just, we have so much overhead, and I wish we could make this accessible. I wish we could make this covered by our medical systems and have access. That's my dream. But in the meantime, we can get these out to people.
So you built it?
Well, I didn't build it. Again, you talk about amazing China. I've been working with them as a builder over there. They build custom devices for tons of different companies. There's the Quiet Mind. There's the Dr. I think it's Dr. Weber in the United States and stuff. So, but I wanted a specific model that had just a specific wavelengths that we use in clinic.
So
that we use. This is just 810.
Oh, so near infrared.
Yeah, so just like our laser, but this is LED 810.
Right.
So with this treatment, we know that all the studies that have been the most positive and beneficial have been with 810 wavelength for the brain. It passes through the skull beautifully. Uptake is really good. So I had them build this for me, and we've only had our custom one for about 2 weeks now. We had the prototypes now for about 4 months.
Very good.
We were running them in clinic side by side with our Thor, because I have to know it works, and I have to say, we did this in clinic and these are the results that we got. I can quote 500 studies, but I need to see it, smell it, talk to the people that are doing it. And we are so excited with the results that we're getting with this.
Yeah, and you're your own. You are your own doctors and your first patient. You need to be treated every day, also, right?
Yeah, exactly. And we can treat. So this device, we can set multiple frequencies. So we can do multiple different conditions. Like I said, the different pulses. So the alpha, the gamma frequencies. So our gamma is going to be our Parkinson's and our dementia clients, that kind of thing. Cleaning up the debris and also stimulating. It's great for depression and anxiety. The idea of the parasympathetic, just sleep before bed. I put this on for half an hour before I go to bed, and my brain literally doesn't stop spinning. I'm dreaming about, crazy things, old PTSD things. And after I've had a half an hour session with this at home, I sleep amazing. My body's calm. I get up in the morning and I feel refreshed. If there was one thing that I could build a gazillion of these things and literally deliver them to every ward in every hospital around the world and say, put this on your patients that are in pain, put this on our mental health and our brain health issues, put this on people that have any neuropathic issues, and you will see
schizophrenia, ADHD, and
oh
all.
yeah, bipolar.
Yeah.
We've got so many clients that are bipolar.
Yeah.
But pain takes the toll, and you talk about that emotional damage. So
yeah.
so we're pretty
well. Congratulations for this achievement, and I wish I had one. And
well, let me know.
but
So
I
let me know.
I have other devices. I had the pads and all. So
Yeah.
we start. I'm like you 5 years ago. I'm using LED
nice.
pads at
Nice.
my clinics.
That's the thing. So we found same thing, same manufacturer that's built this for us. They're putting some prototype things together because we need to treat the lymphatics and stuff while we're treating the helmet. So we have to do things. So we want to treat blood. So there's these watches and stuff that treat the blood. You can wear it for an hour or two at a time, and you're irradiating the blood. We've got these funny little things that are have you seen these ones that go up your nose? Yeah. So so again, these are all simple devices that are easy, that we can put them in I don't even know how much these are costing because these are all just prototypes right now. But for a couple $100, you can get a whole setup that we can treat people at home. So, and you're going to get the benefits.
Mainly for the brain issues.
Exactly. Blood flow, lymphatics, all for supporting the brain. Yeah.
That's mind-blowing. You're an amazing guru.
Oh God. All right, don't get carried away. Passionate.
No.
I'll settle with passion.
I wanted to say voodoo.
Yeah, no, say passionate, but we're doing it. It's real. And that's what I want to share to people, that there's a lot of clinics out there that have these devices and they're scared to use it, and besides some of the class 4 stuff, and I know I get flack from the class 4 companies all the time, but those are pain management type of devices, and that's what we've seen. We have a class 4 in clinic, and we use it when we can't touch somebody because they're so super sensitive. So there's tools in your toolbox that you use at the right time. And I don't want to shy people away from that, but as long as they understand their tools and how to use them properly.
There is much more than just like that.
Absolutely, right? And because what I see that's the killer to the PBM world is, I went to my physio and they've got this class 4 laser and it felt good. I walked out of there, no pain, but an hour later, oh my God, it was worse. Yeah. And then I go back and there's no repair. So that's not, and then they say, well, I tried laser and it didn't work.
It has an analgesic effect, not a repair effect.
Exactly. So
that's different.
And there's tons of studies with these new pulse lasers and stuff. And they say, well, super pulse this and super pulse that. Well, why don't you just get a class 3 that actually does that treatment? Because the pulse is literally just chopping the energy. So the same amount of power is actually going into the cell. So get something that you can actually have better control on, hold it in the place, become a good practitioner, find the spots, find those trigger points, find those things with your hands, make that contact with the client, build those relationships, that trust. Just like anything else in holistic medicine, we're treating the spirit, with the body, the mind. And when you build that trust with the client, you're going to get better results. You're going to get increased placebo. You're going to get that warm, fuzzy feeling that somebody actually gives a crap about that person, and they're not just a sheep coming through a treatment system, right? There's so much to it that is intention is key. right?
Yes, well, I can talk about it because I'm an energy healing therapist and I cannot show any device. This is the
Yeah,
device I'm using, and
yeah,
it works.
yeah.
But I
I haven't
love
even
photobiomodulation as well. But
I
you
haven't even
have
talked to you.
problem to defend your method.
Yeah,
Imagine myself.
yeah. Well, I haven't even talked to you about that side of my voodoo side, because I went and spent a month in Costa Rica with an incredible fella named Michael Dalton, who's a bioenergy worker. So I actually did my second level bioenergy practitioner, and I do energy sessions in the clinic as well. And I got to say, the talented energy workers that are out there, I am blown away
Yeah,
with the effectiveness of it.
yeah, yeah.
And
That's my
I'm a
life.
believer. Yeah, I'm a
That's
believer.
what I'm doing.
Yeah,
But it's
love it.
very in Canada. This is very difficult for me to even make understand that there is science behind it. There is science
There
and
is.
spirituality.
Yeah.
But
And here's the science brain when I was being taught the bioenergy work, that we can actually take a picture of somebody with a thermo imaging camera
yeah,
before and after an energy
yes,
session, and we can actually see the aura,
yes,
which is our electromagnetic field that's around us, because literally we're a nuclear power plant on two legs,
yeah,
right? That's what
yeah,
we are.
yeah,
And when you've got energy blockages or dysfunction, you have decreased or increased cellular function. So
absolutely.
biologically, it is explainable, and that's what how I needed to understand it. So when I'm working on somebody and we set it up and we have a nice 15 minutes of qigong or whatever, breathing and getting grounded, and when you actually find a spot on the person and they look at you like, oh my God, what
What
is
did you
that?
do?
Right? And you're 6 inches away from them,
Yes,
right? It's pretty humbling to
yes. Sometimes
go
I'm
through those.
more than 6 inches. Sometimes I'm 6,000 kilometers, and that's
Yeah,
more
yeah,
than 6 inches.
yeah,
And they're telling me,
absolutely.
what did you do?
Yeah, exactly. Yeah, I
Well,
love it.
I tell them, come to my class, but because in
Yeah,
5 minutes you can't explain that in 5 minutes. I can, but I mean, it
no,
is.
no.
I teach that.
Yeah. So we got to talk energy work, and we got to talk oxygen. We could start a whole show here, my friend.
Thank you so much.
And thank
You're
you.
the best voodoo I ever met. Thank you for participating. I will keep in touch with you.
Very nice to meet you, sir.
All right. Talk to you soon.
Take care.
Goodbye.
Bye-bye.
Bye.